I think during the pandemic, it was an extreme, it was a complete eye opener. I think, 2020 was the year of the nurse. You know,
Mhm.
mm, Going back to Florence Nightingale, who, is the patriarchy to nursing, um, she did say that it would take about 100 years to see what nursing really was about. And that was in about 1920. So we're
Mm.
looking at about 100 years later where, we saw the
Mm.
pandemic and, saw how essential nursing truly was, when it came to taking care of patients and making sure that, we were doing our best.
From the Southwest Health Equity Research Collaborative, this is Fairness First, a podcast dedicated to exploring issues of health equity in the Southwest with a special focus in Northern Arizona. I'm Alexandra Zamarron. May is National Nurses Month, and registered nurse Cristian Erick Tapia talks about what it means to be a nurse in Northern Arizona, working with indigenous communities, and his experience during this COVID-19 pandemic. According to a recent report, The Future of Nursing 2020 to 2030, charting a path to achieve health equity, by the National Academies of Sciences, Engineering, and Medicine, nurses have seen firsthand COVID 19's inequitable impact on the communities they serve, but also nurses have experienced firsthand COVID 19's inequitable impact as a profession, with nurses being more likely to die from COVID 19 than are other healthcare professionals, and nurses of color are far more likely to die. In 2020, we have seen how nurses represent powerful and vital agents in advancing health equity. The National Academies of Sciences, Engineering, and Medicine identified recommendations to support nurses' active participation in achieving health equity and racial justice at an individual and structural level. So, to read the entire report, we encourage you to visit www.nap.edu. And, if you have a nurse in your life this month, make sure you do something to take care of them. Now, let's go to our interview with Cristian. Bye. Cristian, thank you so much for having this conversation with us today. Being a nurse and working in healthcare, it's really stressful and busy. And so, thank you so much for your flexibility and your time. So welcome.
Thank you. Thank you for having me. Thank you for inviting me. I'm excited to be here.
So, as a side note, you all might be hearing some jiggling around, and those are Christian's puppies, just to let you know. But, Christian, tell me more about you, who you are.
Well, as you said, Alexandra, my name is Christian. I am actually an immigrant from Mexico that's been here since 1994. I was raised in Tucson, Arizona, and currently have moved to live here in Flagstaff, Arizona. Um, I graduated, high school back in Tucson and went into college with the intention of becoming an engineer. And of course, while you're in college, you discover different fields that you're interested in. That's when I decided that engineering wasn't for me and that healthcare was the field that I needed to go into. So that's when I decided to switch my major and decided to become a nurse.
Mm. Yeah, what a big shift from engineering to nursing. What happened? Why that change?
So primarily, what ended up happening is I was doing a shadowing at Raytheon down in Tucson, and while doing that shadowing, I realized that I didn't want to do projects by myself. I didn't want to, have an input into a project and then take it to a team and then decide if it was worth it. So that's when I decided that I needed to do something different. At that same time, my grandmother ended up getting extremely sick, and we had to take her home on hospice care. During that time, while she was home, I actually was there as her primary provider to take care of her for the last 3 weeks of her life. So after she passed away, I decided that healthcare was where I needed to go, just from that experience I had with her. So I decided to go up to my advisor and let him know where I was standing with, my choices. And I got the experience to actually shadow at what used to be University Medical Center down in Tucson, now Banners. Realized that it was what I wanted to do, and decided that that was the time to switch my major and go into nursing.
Yeah, so how long have you been a nurse?
So I've been a registered nurse for almost 9 years now. Prior to that, I was an LPN, a licensed practical nurse. And then prior to that, I was a certified nursing assistant. So I've been in healthcare since 2009.
Wow.
So about 11 years in healthcare, but about 9 as a nurse.
Yeah, that's a long time.
It's been an experience. It's been something, that I've learned a lot through. I've grown a lot through. And it's been, an experience that's changed my life for the best.
When I think of nurses, I often think about a lot of intense work because when we think of care work that requires so much energy and labor, how has that experience been for you?
Well, I think primarily, being a nurse is extremely physical and mental work. For the most part, physical because you're constantly on your feet. Rather, you're working in a hospital, a long-term care facility, you're working as a case manager, or so forth. You're always on your feet, moving around, trying to get the duties done that you need to provide the best care that you can. So it becomes physical. Lifting patients, turning patients, bathing patients, and that depends, on where you're working. If you're working in critical care or a med surg floor, or a progressive care floor, each floor is a little bit different, and each floor gives you different, nurse to patient ratios, but it becomes extremely physical. On top of that, you are dealing with people's lives. So you walk into your shift with that mentality that, your job is to make sure that that patient goes home to their family. So it becomes a mental battle when you walk in and you have patients that are extremely sick, and you're trying your hardest, and you're doing the best that you can to make sure that they get better, but somehow, they don't, and they start deteriorating, or they start, getting worse, and it becomes a mental battle where you feel that you could have done more when in reality you've done the best you can at that time. You've worked with the healthcare team, you worked with the physicians, the therapy team, your case managers, your other coworkers to provide the best care possible. But somehow, the body, as we all know, shuts down at a certain age and at a certain time. So it just becomes a mental battle that sometimes you have to leave behind and not bring home with you. And you learn to do that with time. I feel like in the beginning, it takes a lot of time to be able to detach yourself from your patients, from the experiences, from the phone calls that you've gotten with the family, from the connections that you've made with patients that have been there for weeks that you've been taking care of. So it is extremely a physical and mental field.
How was it to be a nurse and how did it feel to be a nurse during this COVID-19 pandemic?
I think during the pandemic it was an extreme, it was a complete eye opener. I think 2020 was the year of the nurse. Going back to Florence Nightingale, who is the patriarchy to nursing. She did say that it would take about 100 years to see what nursing really was about. And that was in about 1920. So we're looking at about 100 years later where, we saw the pandemic and, saw how essential nursing truly was, when it came to taking care of patients and making sure that, we were doing our best. When the pandemic first started, we didn't know what we were dealing with. Just imagine walking into a unit that you were so used to seeing, clean halls, everything organized, non-chaotic, and now you open these doors and it was like out of a movie. It was chaotic. People were trying to understand what was happening, how to take care of patients, and we were getting patients that were coming in, and within 30 minutes they were getting intubated, and within 48 hours they were dying. So you went from, knowing what you were dealing and knowing how to take care of a patient, knowing how to take care of a multi-level trauma patient, to now, fighting an enemy that you had no idea how to handle. And it went from having not necessarily just one patient a week passing away, but to having 5, 6, 7, even up to 10 patients passing away within a week. So it was constantly, death all around. So on top of the chaos and trying to understand what was happening and trying to make sure that, we were staying up to date with everything that was happening and the treatments that were happening, and picture, a battle zone, of multiple, nurses trying to find an enemy that they couldn't see, that they couldn't find, that, was coming from different sides at them, and not knowing how to defend themselves. And it wasn't just something that we were trying to do for our patients, but also that we were trying to do for ourselves and for our loved ones, because you didn't know if you were going to take it home. You didn't know if everything that you were doing was exactly what you needed to do to prevent yourself from, getting the disease. So it was truly something that, unexplainable unless you were actually living through it day by day. Yeah. Because no matter how you explain it to somebody, or no matter how you try to show somebody of what you went through, they weren't there to see those people dying. They weren't there when you held, your patient's hand, because their family couldn't be there, and the only thing they could do was see them through a screen while they passed away. Most definitely terrifying and, traumatizing. And I think even now, we're looking at over a year of dealing with this, because even though within Arizona we got hit more towards the summer, the Navajo Nation got hit around the same time New York did. So we were dealing with the pandemic way before the rest of Arizona was. We had to get the state involved because we were getting so many patients from the nation that we had to reach max capacity. We had turned every single one of our critical cares into a COVID critical care, and we had turned multiple med-surg floors into, COVID floors. So we had reached capacity physically, but also mentally.
How did you cope with it?
I think the biggest thing was it was just realizing that, at that moment in time, if my father or my mother or my brothers or sisters or anybody that I truly care for fell ill and they went into a hospital in a completely different city, that they were being taken care of the same way I was taking care of the patients that I had. So telling myself that what I was doing was for the best, and that what I was doing was, what I wanted to be done for my loved ones if they ended up in the same situation.
Thank you for sharing all of that, and for all the work that you've put in. So thinking about that work and the intensity of it, what do you need as a nurse, and what do you think other nurses need to feel supported, to feel like they can thrive in the work?
We as a healthcare family, because nursing is like the mafia. Once you're in it, you're in it, and if you try to get out, there's issues that happen. So I think the biggest thing was that, we became a stronger family. We were there for each other. We were constantly checking up on each other and asking each other, how are you doing? How are you holding up? What do you need? What can I do? It became such an amazing community where, people didn't want to go home to their families because they didn't want to expose them. So the community stepped in and said, I'll take care of your kid. I'll watch your kid while you're doing this. I'll make sure that they're being safe and they are taken care of. And I think, in the end, what we as healthcare workers, as nurses, need is for the community to actually listen to us, to actually understand us, to know that what we're doing on an everyday basis is to try to save your loved one and take care of them and make sure that they go home safe. And a lot of times it's hard because, we know the outcomes of certain situations, and we're trying to stay positive and provide that, positive attitude towards your loved one and yourself. And, it's hard to do it when We have people in the community who, were calling us liars or telling us that we were part of a government experiment, or that we were, getting paid to say that this was a pandemic, or, that our patients were dying, and so forth. So it became, extremely hard to go from, you are a healthcare hero to now you are just another sheep for the government that is saying that this is happening. When in reality, we knew exactly what we were doing on a daily basis to try to prevent the spread. So I think as healthcare workers, and not necessarily just as nurses, but anybody within the healthcare team, our providers, our hospitalists, our specialists, our intensivists, what we all need is for the community to actually listen, and do their part, continue to do what they can to stop the spread. I know that vaccinations are out and a lot of people are vaccinated, but there's still a big majority of people who are not, and that is because maybe they don't have the resources, or they live in communities that are not providing the vaccinations that are needed. Here within Arizona, we've had our mask mandate lifted. Our bars are opening, our restaurants are working at full capacity, when we still have communities such as the Latino communities, or people of color, or the black communities that have a vaccination rate of only 25%. Not just because you're vaccinated, you're gonna go and do anything possible to go back to your normal life, because in the end, you may be a carrier, because having the vaccine doesn't mean that you can't get the virus. It's just you're more likely to have the antibodies to fight it off, but you can still, spread the virus around. So taking into account that there's more than just yourself, there's a community, there's people around you that you can actually change their life.
What does it mean to you being a nurse in northern Arizona and caring for indigenous communities who are often exposed to health inequity?
I think the biggest thing of being a nurse in northern Arizona, is that we do have a lot of patients that come in from the Navajo Nation, which is the largest indigenous nation within the U.S. We are primarily the advocates for these patients. A lot of times, we'll get patients from the Navajo Nation that have been dealing with the situation for quite a while, and they come into the hospital as a last resort, because they've tried everything they could at home, which would include going to a medicine man or any home remedies that they were used to. So a lot of times when they come to us, they're extremely ill. When it comes to patients from the Navajo Nation or the Hopi reservation, you have to provide the information to everybody. You'll have a daughter or a son call, and they'll want information, and then the cousin sister will call and she'll want information, and everybody from the clan actually wants to know what's going on, and they want to hear it from you. They don't want to hear it from their other family member. They want to hear it from that healthcare worker. So many times, we are advocates for that. We advocate for making sure that the family understands. A lot of times, they don't have the resources at home. They don't have electricity. They don't have water, because of where they live. So it's advocating that they go to a rehab facility, convincing the family that they need to go to a rehab facility because they still require oxygen, and they won't be able to have that at home, because they don't have the electricity for the concentrators and thus forth. So our primary role is primarily educating, and advocating, and knowing that we are doing our best to send these patients home safe, because in the end, that's our goal, to be able to send our patients home and safe. Of course, making sure that we are being culturally sensitive to what they need. And yes, it's extremely hard, and it can be frustrating at times when you're working critical care, and you have multiple family members calling, but it's having that understanding that that's their peace of mind, and knowing that you're going to provide that peace of mind because you spoke to them. It's a good feeling in the end.
If we understand health equity as everyone having the opportunity to achieve optimal health and having access to everything that they need to be as healthy as possible. What then is the essential role of nurses in addressing the root causes of inequity or injustice? And what is their role in advancing health equity?
The essential role and the primarily role of a nurse is to be that advocate for that patient, to be frontline worker for that patient, pretty much, because you as the nurse are there primarily for 12 to 13 hours with that patient, if you're working within a hospital setting. So the majority of the other team members come in, they do what they have to do for 20, 30 minutes, an hour, depending on what they're doing, and then they leave and continue and move on to another patient. Mm-hmm. You're there with that patient, so you know exactly what is going on. You are that, that middle person that has all the information primarily of what's going on with your patient. So you become that advocate, and that advocate in regards to if you realize that there's multiple things happening with your patient and there's multiple team members involved, you make sure that everybody is aware of what's happening, what's going on, the outcomes of, the decisions that are being made, because in the end, when we're taking care of patients, we're making decisions on their lives. Also, you become that advocate where if you realize that there's an outcome that, is not going to be the best for the patient, you speak up. And it's a constant battle every day where you're making sure that you are taking into account everything that's happening with your patient within that 12-hour shift, and you're communicating it to every single member within the healthcare team. A nurse is the primary role of the nurse is to be that advocate, to be that, that middleman within the multidisciplinary team to provide the best care every single time to our patients.
We've been friends for a very long time now. I just appreciate you so much. And do you have anything else you would like to add?
I think the ups of being a nurse is when you actually get to see that patient go home. It's seeing, family extremely happy when they call you over the phone and you're able to put that phone to that patient and they're able to talk to them and communicate with them.
Well, thank you. And, happy National Nurses Month.
Thank you.
I owe you the gift.
Someone can pay me for vacation to Bora Bora.
We want to hear from you. Visit us on Facebook at NAU Share, Instagram at NAU.share. Follow us on Twitter at Share Arizona, that is CHER Arizona, or send us an email at sherc@nau.edu. Tell us what you like, what can we do better, or tell us what topics you want to listen to in our podcast. The Southwest Health Equity Research Collaborative, Community Engagement Core, and the Media Innovation Center at NAU produced this episode. It was edited by Alexandra Zamarron Longorio, music from filmmusic.io, song titled Fearless First by Kevin MacLeod, licensed by creativecommons.org. Special thanks to NIMHD grant number U54MD012388 and Northern Arizona University Southwest Health Equity Research Collaborative for funding this podcast. Thanks to our Fairness First team, Carmelita Schiff, Dulce Jimenez, Lisa Dam from the Community Engagement Core, and Brian Rackham, Director of the NAU Media Innovation Center. Thanks for making this podcast possible. I'm Alexandra Zamarron. Thanks for listening.